Hello, I'm Dr. Robert Hoover II, podiatric surgeon, and I'm here today to talk about a very common problem I treat in my practice, and it's children's flat feet and adult flat foot deformities. There's something called talotarsal dislocation syndrome, where when you stand up, the arch will collapse, the heel will turn to the outside, the forefoot will abduct, and most of the time parents see it as their child is walking a little bit funny. It looks like their arch is collapsing, it looks like their heel's turning out. They'll see their pediatrician, they'll say, go see your foot doctor. Typically when they come, we'll notice that there's not a whole lot of pain when they're children, but as they become older it can run into a lot of problems. Now, my little model here, I'm just going to show you basically what's going on. Typically when the child steps down, the joint between my two fingers right in through here is too loose, so the heel will swing to the outside, the front of the foot will swing to the outside, the arch will collapse down, and what you'll see is a foot that looks like it's extremely flattened. If not treated, normally when we treat, we'll treat with a little arch support to try and resume the arch, which will take care of the excessive motion. But oftentimes an arch support is not enough to correct the problem. We'll actually do a small procedure where we'll actually make a small half-inch incision on the outside of the ankle. We'll put a little stent or implant in, which will actually swing the heel back underneath the leg bone. When that happens, this talus bone will swing up and the front of the foot will come back over, and it will correct basically all the deformities you're seeing in a flat foot with one small 15-minute procedure. Sometimes the front of the foot will actually be deformed up and we'll have to do a little procedure to drop that down. Sometimes we'll actually have a tight heel cord. We'll have to do a little lengthening of that to drop that down as well.